It's now time for the annual meeting's question period. Registrants can enter their questions through the chat featured in this session. We will do our best to answer as many questions as time permits. To accommodate questions from as many registrants as possible, we would ask that you limit yourself to one question only. If questions are left unanswered, college staff will respond to those questions via email within the next 2 weeks. I would like to ask Sarah Chaudhary, the college's Director of Communications, to read some of your questions. Sarah?
Thank you, Danitha. Just a general comment noting that we have really positive comments to Lise, congratulating her on her upcoming retirement. So I thought I would share that with you, Lise. A few questions coming in, and just a reminder to please submit your question in the chat and we'll do our best to get to them. So there is a question regarding the exams, with a registrant wondering the exams starting in 2027. Do we know if this exam will be virtual or in person? Wondering around accessibility and barriers for that one.
Thank you for that question, and I just would like to take the opportunity to highlight the fact that these exams will be for applicants to the college and not for registrants. So these are entry to practice exams. And the versions of the exam that the college will be using in 2027 are not the versions that are currently in use. So they are under development, and it's an extensive and very comprehensive process to develop those exams for 2027. They are delivered remotely at test centers, virtually at test centers, and for that reason there are various accessibility issues that are covered through the exam, the ways that the exams are offered in those test centers. So I would just suggest as well that if you're interested in hearing a little bit more about that, you can read about the process on the ASWB website, which contains a huge amount of information about how entry to practice exams are delivered.
Thank you, Lise. We have a question from a registrant wanting information on the college's role being played to address systemic racism. So perhaps some questions around some of what your report shared. Lise?
Thanks, Sarah. And thank you for that question. I think it's an incredibly important question because regulation generally and regulators across Canada and internationally have appropriately begun to recognize how diversity, equity, and inclusion, and in the Canadian context, truth and reconciliation, are very much part of its public protection mandate, and that wasn't always the case. So I did want to start there. I also wanted to highlight that the current strategic plan has diversity, equity, and inclusion as a strategic priority, and without a doubt that will be woven throughout the strategic plan that the college will be developing in the fall. So I think what this really highlights is that as an organization, simply as an organization, and like any other organization, the college has a responsibility to address issues related to diversity, equity, and inclusion, and truth and reconciliation. But then more specifically, in terms of regulating social workers and social service workers across Ontario, there's another responsibility to regulate the practice and ensure that our registrants are competent with respect to practice in terms of diversity, equity, and inclusion, and truth and reconciliation.
Thank you, Lise. We have a few questions coming up around the exams again. And so one question around wanting to ensure that there's accommodation for different intersectionalities for those applicants who are planning on writing the exams in 2027. If you can maybe provide a little bit of context around the process leading up to that.
So I think the short answer might be yes, and thank you again for highlighting this very important consideration. I think perhaps the question may also allude to the ASWB's release of data related to the current versions of the exams that are in place, and very concerning information that came out as a result of that benchmarking data. At the same time, I think it's extremely important that ASWB took the very courageous and groundbreaking step of releasing the data, because until you actually look at data, you can't really address how you might solve it. So I think one of the things that is currently underway, even since the release of the data, is efforts on the part of ASWB and with the collaboration of Canadian social work regulators, so across Canada, to begin to address the issues that have been raised by the data. I do want to emphasize that some of the issues raised by the benchmarking data are beyond the scope of any one organization. They're truly systemic issues. And so it's very important to have that data and to engage in collaborative conversations about how to move forward with that data. Having said that, I'll just go back briefly to my previous answer about accommodations, that these are issues that the ASWB has been considering for many years in terms of implementation of the exam, but I think that their efforts to address these issues have intensified as a result of the issues highlighted by the data.
Thank you, Lise. There is a question related to the controlled active psychotherapy, noting that there seems to still be confusion in the public regarding the ability for registrants, for social workers and social service workers, to practice psychotherapy. Can you provide some more details around those who have the right to practice psychotherapy?
So thank you for this question as well. I was thinking, reflecting back, as I approach my retirement, it's been a few years since psychotherapy and the controlled active psychotherapy was regulated in Ontario, but speaking of long runways, it was a very long runway to regulate psychotherapy. There is very detailed information on the website, but that I would refer you to in terms of understanding which registrants and which registrants of which colleges have access to the controlled active psychotherapy, but more specifically, what you as a registrant of the college should know before you practice or provide the controlled active psychotherapy. So really encourage you to look onto the website for that and many, many other things. I also want to highlight the hard work of our professional practice department, who, among those thousands of practice inquiries that they respond to each year, also speak to just this issue around psychotherapy. What does it mean to be competent? What is the controlled active psychotherapy? And I think as well there are very important opportunities for communication with the associations who are joining this meeting today, because it is an ongoing challenge for the public, employers, and sometimes registrants to understand details around and obligations around the practice of psychotherapy, for example. Thank you.
We have a few questions coming in around the troubling increase in sexual misconduct-related complaints. Questions wondering whether the college has plans to examine the potential causes and treat that end of the problem, noting that isolation caused by the pandemic may be a factor in the increase, and what could we do to reduce isolation that is clouding the judgment of so many social workers and social service workers?
I'm very glad to get a question about this deeply concerning issue, and I think that's already been communicated by a number of us, how the issue of the increase in sexual abuse of clients by registrants is increasing significantly from the year prior. I think when you, and in short, part of the risk mitigation strategy is to address this issue not just at the end of discipline, where a matter, where sexual abuse of a registrant has occurred or is alleged to have occurred, and in many instances, if you look at our website, has occurred. It's important to address as well what some of the potential causes of the increase and of the sexual abuse of clients by registrants may come from. And that is what the risk mitigation strategy is intended to do. And already there are many efforts underway, and John was mentioning in his report the required readings for the continuing competence program. So I think those are examples, much more work to be done in terms of examining how best to approach this concerning issue, but certainly supporting registrants in ethical and professional practice, understanding boundaries, understanding their obligations under the Code of Ethics and Standards of Practice is an important piece of that. And I would suggest that isolation factors in there. So it's not any one factor that causes this extremely concerning conduct. And it's important to look at it very holistically and at the preventive end as much as possible. So I would say that our risk mitigation strategy attempts to address it, not begin to address, because we've already been working on this, but to address it more systemically across that continuum.
There's a follow-up question that we've received around the sexual abuse-related complaints, asking, are we sure that the increase in complaints is a bad thing? Could this be because of increased awareness and of the public and the complaints process? The latter would be a good thing.
Mm-hmm. Absolutely, and I think we are. Any increase in referrals to discipline or in complaints received is reflective of some of the things that we've been talking about, increased awareness of the college and its role, and we've been aware of that for many years now. So it is not entirely a bad thing, but it is deeply concerning that this conduct is happening. And we need to, as I said, address it across a continuum of prevention, education, and then through our complaints and discipline processes.
Thank you, Lise. A few additional questions related to entry to practice exams. Wondering if there is a plan in the future for registrants to complete the exams, and also questions around the format of the exams, whether it's multiple choice or what the format is.
Mm-hmm. So again, I would refer you to information on the college website, more detailed information than I can get into here. But you'll see that information and Council's decision in September of 2021 was about entry to practice exams. So those exams are for applicants to the college, not for registrants. The other piece that I want to emphasize is that in our ongoing collaboration and work with ASWB, and I think our college has confidence in ASWB's efforts to address the issues raised by the data. Among those sometimes raised are concerns about a multiple choice format for the exam. And I think ASWB is well underway with, as part of the practice analysis that will eventually inform the versions of the exam that are implemented in 2027, is consideration of alternate ways to measure competence at entry to practice. So I want to emphasize it's important to measure competence at entry to practice, which is very different from getting a credential, an educational credential, which is also very important. It's not an either or, and exams are an additional tool. But I think ASWB's efforts to look at the format even within the multiple choice format, ASWB has already, just in this spring, made some changes to the format of the exams in terms of the options available within that format. So I think really can't emphasize enough how much this is a work in progress.
Thank you. We have some questions around budgets. A question first congratulating you on your retirement, Lise. Noting that savings that come from having Ahmed virtually would have resulted in savings. What were those funds used to do? And just noting they weren't sure if it had been addressed in some of the previous reports.
Mm-hmm. Well, again, it's great to get questions that really emphasize the wonderful news of Ahmed being virtual, because I think in being offered virtually, Ahmed is accessible to such a much broader range of or number of our registrants, and that's fantastic. The other thing that's great is that all of the sessions at Ahmed then become practice resources for registrants, which is another kind of, it's not a side benefit, it's an important benefit of Ahmed. I would also say that our hardworking communications department, as they will attest, there are not necessarily always the same savings that you might think when you offer an event virtually, because there's a great deal of work involved and many resources involved in offering Ahmed virtually. So I would emphasize that. The other thing that I would say is it is important to look at the budget overall. So the college, it isn't a simple moving X amount of funds from one budget line to another. In the budget that the Finance Committee recommends to Council for approval and that Council approves, the lead up to that includes very careful consideration of the programs and services that are being offered by the college in order to fulfill its public protection mandate. And so revenue is then allocated to those different budget lines in order to ensure that we are doing the job we're here to do. And so much as I'd like to answer that directly, I think it's actually more appropriate to put it in that broader context.
There's a comment from a registrant noting it's good that the college has worked to address salaries to match increasing inflation for its staff. Salaries for registrants across the sector have not increased. Is the college working across the sector to also raise awareness or advocate to address salary disparities across the sector?
I realize that I answer every question with a thank you for the question, but I do genuinely thank you for that question, because I think it gives me an opportunity to highlight the role of the college and also the role of the associations who are attending today's session. So the work of college staff, the very hard work of college staff, those positions are not social work and social service work positions, they're regulatory positions, and I agree it's very important for the college to ensure that it has a qualified, high-performing staff who will stay, and I think we're very fortunate to be in that position. Concerns, we at the same time recognize the pressures that you, our registrants, are under, facing inflationary pressures and various other employment-related challenges. Advocacy for those issues falls very much under the mandate of the professional associations. So if you haven't already, I would strongly encourage you to reach out to your professional association to discuss those issues and those concerns. My guess is that much of those conversations is underway, and you'll probably find it very helpful to hear about those efforts.
Thank you, Lise. We have a question related to the regulated health professionals. Wondering if there's any work being done to support social workers and social service workers to become a regulated health professional, noting that their colleagues have discussed the challenges experienced to be properly and supportively recognized as a valid healthcare worker within the system. If not becoming part of the regulated health professionals, then what other work is being done or can be done to support us working in healthcare?
And that's a big question. Thank you for that question as well. So the college is created by the Social Work and Social Service Work Act, not the Regulated Health Professions Act, and that is what makes a profession a regulated health profession is that they're regulated under the Regulated Health Professionals Act, or the RHPA. It is a very good question. But the reality is that we work within our legislation and report to our ministry. John was mentioning in his report, speaking about our government relations work. I think this is a very important example, an opportunity to highlight information about how the college works closely with our ministry, but also the Ministry of Health, to ensure that policies, issues, legislation impacting you, our registrants, are at the forefront, that the Ministry of Health is aware of those issues. And so I think that is a recognition of that ongoing issue is why we continue to engage, part of why we continue to engage in our government relations efforts.
I might just add to that in the past couple of months we've had an opportunity to engage in a very constructive dialogue with a senior assistant deputy minister in the Ministry of Health about that exact issue. And I think what comes from that, and that was mentioned earlier, is the important role that our registrants in both professions play in addressing the significant challenges of health human resources in Ontario, and certainly the significant challenges facing all sectors of our society around mental health. Our conversation with the Ministry of Health is going to lead to a more organized dialogue, if I can put it that way, within that RHPA world. Doesn't mean we're going to become a part of that group formally or designated under their legislation, but the door is open for dialogue at a policy level with the Ministry of Health, and I think that's a very positive step forward.
There is a question from registrants asking for examples or perhaps more information around the college's strategy in implementing to support Indigenous and African descendants, in brackets, Black.
So I think what I might highlight, because this is a big question and a very important question, and what I would first highlight is the Equity and Inclusion Data Initiative, because John spoke to that initiative. I mentioned it briefly in my report. I think that we've come to realize as a society that having data in order to better understand issues and then address them is critical, and that's what the college's Equity and Inclusion initiative is about, collecting race-based and other demographic data from registrants as part of a renewal process. And there have been, as you know, broad consultations, very broad consultations, and we've taken a significant amount of time to make sure that we engage in those ongoing consultations and conversations. There are many other ways that the college is working on these issues. I'd highlight as well the practice support, the practice resources that we have developed for registrants. This is partly written resources that are available on the DEI webpage, as well as the Indigenous webpage on the college website, but also as well as written resources, also various events such as Ahmed and the educational forums, where we ensure that the themes reflect the very complex considerations around these issues and practice around these issues.
I'd just like to add a comment to that one as well, and it's an absolute truism that good governance demands that a governing body reflect the faces of the people that its members, its registrants, serve. I'm very proud of the fact that the composition of the College Council reflects many of the faces of the people that we serve in several different dimensions. And I can reassure you that in all of our deliberations around that council table, those diverse folks who are part of our council hold the council's collective feet to the fire and raise the kind of difficult and challenging questions that we need to consider as we learn and unlearn. I think that's an important piece. I'm a little bit of a governance nerd, and I'm very conscious of the fact that as a governing body, to say nothing of our excellent staff, need to be paying attention to those issues and bring the learned experiences and reflections of a wide range of people of Ontario to the table and to the discussion.
Thank you, John. There is a few questions around offering educational sessions to social workers and social service workers. Some asking whether it's possible to have sessions offered on specific topics. They're noting an example, working with older adults in communities or long-term care centers, finding that there is a great deal of emphasis on children and youth, but not much that helps in that individual's field.
This is great feedback, and I would also encourage you to have a look out for offerings from the professional associations, educational institutions, continuing education. There is a lot out there. In terms of the college's role specifically, Ahmed is one of the great opportunities to address some, not all, or at least not all at once, of the themes that you're raising. And we have addressed in past Ahmeds some of those topics. As we've already talked about, the focus of this Ahmed is very much to highlight risk of harm and sexual abuse, public protection, our public protection mandate. There are some resources on the college website as well that you may want to take a closer look at. But as I said, I think there are a range of places where professional development may be offerings may be good to consider. And just one more plug for our professional practice department as well as the continuing competence program. So the professional practice department works tirelessly to provide support to registrants around a range of issues. So if you haven't already, you can call the professional practice team and have a conversation if you're finding that you're facing particular challenges in your practice. It may be that they refer you to outside resources, and in many instances they will, but I think that's one place, one of several places to start, and that the learning that you do in those areas can and should be reflected as part of your continuing competence program, so as you set your learning goals. So don't forget to do that.
Thank you. There is one question from a registrant noting the response time to registrant inquiries at the college can sometimes be slow. That could be partly due to a high volume of membership, which is great. Any consideration to hire more staff to assist with resources?
That's a very good question. You might have heard us reference over $28,000, over 28,000 registrants of the college, and it's always nice to have round numbers because you can report on them more easily. And yes, the college does get a high volume of calls. And in the budget for 2023, there were several new positions that related to the range in, the increase in the number of inquiries to the college across departments. So you can't have such an increase in your registrant base without having a subsequent increase in the demand for services associated with that increase in the registrant base. That's a very good thing. We see that as a very good thing, and yet we also want to make sure that you and other stakeholders are not facing long waits to have your call responded to. So yes, the short answer is we have very recently made some changes to our operations to ensure a more timely response to inquiries.
Thank you. We're noting a few positive comments around having Ahmed in today's annual meeting virtually, so appreciating how informative it has been. There is a question around requirements for the child protection workers, noting that recently the college required executive directors of CASs to be registered members of the college. Is there any work happening to have all child protection workers registered with the college?
This is a very important issue that the college has been working on for several years. I think the college's position on the registration of CAS workers is that if somebody is, if an individual has the educational qualifications and is eligible for registration with the college and practicing within the scope of practice, which child welfare work certainly falls within the scope of practice for social work and social service work, then they should be registered with the college. So I guess the short answer would be yes, that work continues.
Thank you. There is a question around funding opportunities for professional development and completion of the CCP. Wondering if you can provide some details for that.
That would be, and that's a little bit of two questions in one, I think, because the Continuing Competence Program and learning activities, we're very proud of our adult education model, which really underpins the Continuing Competence Program, and that gives a lot of flexibility for registrants to following their self-assessment and review of the standards of practice, identify areas where they would like to grow and develop and set their own learning goals, and also define learning activities that are not just conferences, workshops that have a cost associated with them most often, but also lived experience and experiential learning activities. So I would highlight that. In terms of funding, there are opportunities for professional development, including funding opportunities through the OASW, and I would encourage you to visit their the OASW website, and that I'm saying that for social workers and social service workers, to get more details about those opportunities.
Thank you. We're approaching the end of the question period, so I think we'll be asking one question, noting whether or not, I'll maybe ask two follow-up questions. So the first one is whether there are plans to continue having the annual meeting and education day virtual.
So yes, I think that the benefits of a virtual format have been discussed and decided upon by council, and moving forward the plan is to continue offering Ahmed in a virtual format.
Thank you. And as a final question around the benefits or the value of registration, wanting to get more information as to what are the benefits or value of registering with the college.
Mm-hmm. So those are important words because they mean different things, and you typically see benefits of registration associated or membership associated with an association that does provide different kinds of benefits. The value of registration, which is the emphasis of our efforts, is a different thing. And I think what registration speaks to, it says a lot about the professions, the safe and ethical practice of the professions, and about the individual professional in terms of their adherence to code of ethics and standards of practice, their accountability generally, their commitment to ongoing learning. These are all very important things that registration with the college says about each of you as individual regulated professionals. Thanks.
This concludes the business to be conducted at the 23rd annual meeting of the college. Thank you for your attendance, thank you for your participation, and thank you for the superb questions that have, I hope, really helped to make clear to all the registrants across the province who are attending today the work that's ongoing at the college.